All right, Dr. we are live.
Hey guys, we're finishing up our operating room procedure with a skin tightening around the eye. And this is called plasma pen. It doesn't look great the first couple weeks, but after it really tightens the area and brightens it, especially with lightning peels and my Aerify kit. But you see what we're doing is we're not even touching the skin. Plasma energy is being released on the surface, and there's little spaces in between to allow for quicker healing. And these little scabs fall off in about a week, maybe less, and then leave dots that tighten the skin. New collagen will be produced and it'll look brighter. This is one of the few treatments you can actually do on the lid with less risk to someone. Because normally lasers are a little bit harder. I did yesterday, we didn't post it, but I did a strong laser treatment of CO2 around the eyes. And that has a lot of downtime, 6 weeks sometimes. But it looks really good when it's done. So, just depends. This is something that's done a couple times a year. And you can see there's some contraction that occurs right now. And we can go all the way up to the lid, which we did here.
Can someone age 25 do this?
You can do this at any age. Actually, the younger the better. And you can do this a couple times a year. I'm going to start doing this when I get back from New York. I'm going to do it every 4 months is what my idea is. After a couple of treatments, people are really, really happy with this. And it's amazing what it does for the crow's feet, which is why we treat it over here on her as well. You can even remove some medical tattooing with this if there's an issue with microblading or any sort of tattooing. So that's the first side being done. You can see all the dots. If you zoom in, I'll pull the light away. Go ahead and zoom in there. Show them all those little dots. Closer. I'll go even closer if you can. All those little dots are gonna tighten up. Now we're gonna start.
Oh, there we go.
I'll start on the other side while you guys are showing that side. And that's the process.
Can you do this treatment on the back of the hands?
Yeah, you can. It takes a very long time for that to heal. And to be honest, the back of the hands does better with global area treatment like a Moxie, Halo, or Fraxel. We do a lot of peels and derma rolling to that area. So if you consult us, tell them how, we can give you our protocol for hands.
To consult with us, please send us a DM with your full name, email, and phone number, or you can email us appointments@jasonemermd.com.
I have a lot of hand videos with filler, with lasers on YouTube. So definitely follow our YouTube, you guys. And literally we just do these small bits. Now, the biggest key to getting a successful result with this is skincare. And we have a whole ablative laser protocol. Same thing for plasma pen. It's on emeragecosmetics.com. But what I tell people to do is pre-treat with Cosmelan 2 or a lightning peel like Enlighten. And then afterwards, we're going to use Silogen, which is a silicone growth factor gel. We're going to use Emerage Skin Refit Face, which was designed to make this heal. We're going to use LED light stim therapy. And we're going to use anti-age serum, which is human bone marrow stem cells. That will make it heal. We use a foaming polish from Emerage Skin to exfoliate. And then, right when it peels, you start retinol and you use my Aerify mask. If you do that, the results are like a CO2. It's dramatic and it's amazing. So,
Dr. Emer, how soon can she cover it with makeup and go out?
the next day, if you really want, my Fusion Shield Sunscreen SPF BB Cream, emeragecosmetics.com Fusion Shield was designed actually for that. So you could literally put it on the next day if you want. My suggestion would be wait till the scabs come off.
Is this plasma that comes from our own bodies?
No, this is plasma that comes from the machine And it's not plasma-rich, platelet-rich plasma. This is radiofrequency plasma. This is extremely different. We're actually going to put PRP and A-cell, which is a stem cell therapy, on her skin right after this to help it heal. And then she'll be doing some lives tomorrow with massage and oxygen facials. Justin over here is going to coordinate all that and make sure it's perfect, especially the IGTV content so people learn. And look, we're literally just tightening. Little spaces between. Very meticulous. Very important that this is done.
Stop so
right. How are we doing over there?
We're doing good. People are
You could do
asking
this.
why not use CO2 fractional instead?
Because she doesn't want as much downtime and she's darker skin type. So I'm trying to limit her downtime in these areas. She also just did a Cosmetic peel and didn't want an aggressive laser. She just wanted something light. She wants to keep doing the peels. Her skin looks amazing from the peels. And we'll have our team make a really good feed post of her everyday transition, an amazing before and after. We could do before and after pictures and video. There's a lot we can do, but she really wanted everyone to see the process. A little tear. You guys could see we can go all the way up to the lid, which is what we're gonna do, right to the edge of the lid. Hold on. Need a battery. They have to bring me a new battery. Okay. So now we're going to keep following. Do you have an overhead light? I marked her little crow's feet. So we're going to get those as well. And shine it right over here. Perfect. Do that. A little bit closer to the eye. There. Good. Perfect. Okay. So I'm just using this to be very meticulous so we can really hone in on every spot. What are they asking?
Will this help with wrinkles and tightening?
Yes, that's the point. And make sure you guys go to emeragecosmetics.com. Get the Aerify Illuminating Mask. Use that on your eye. Use Refit Eye. Really helps it heal with Refit Face and Anti-Age MD Serum. And then we have a whole protocol on what to do pre and post. So consult with us so we can go over that with you. This is going to tighten and brighten and less downtime than laser.
You guys, this is non-surgical. We are not cutting out anything on her eyelids.
She'll be swollen tomorrow, don't get me wrong. But it won't be as painful, it won't be as red. And the risk of pigmentation is much less than with CO2. And this is fractional, you guys. You can see, fractional just means spaces between for healing. And you can see there are spaces, lots of them.
Can this erase dark circles?
What?
Can this erase dark circles?
Nothing can erase a dark circle. Can it make it better? Yes.
Can you do this in place of a blepharoplasty?
Yes, and that's why we did this. She really didn't want a bleph. I had recommended it. Again, we go through very detailed consults with my clients, you guys, and this was one of the treatments. Laser's an option. There's so many options. Bleph.
Where else can you do plasma pen?
I like this around the mouth. Some people use it on necklines. I've never found it to be that great. I like around the mouth and eyes. Some people are doing knee wrinkles, around the belly button, the vagina, anywhere you want some tightening, but it's got to be a small area. This takes a really long time, and doing a whole face with this doesn't make any sense. So people that are doing that, it's ridiculous. It just doesn't make sense. You see, we're not even really touching the skin. Plasma distributes through conductive energy. I even did this on Insider, Beauty Insider. So the whole thing online, so check it out on my YouTube and Jason Emer MD. What are they saying? Jordan?
Can the plasma pen be administered with lattice degeneration?
Who? Can they what?
Can the plasma pen be administered with lattice degeneration?
I'm not sure what that is, but I can combine it with lasers and we use it for anti-aging, so definitely there's a lot of opportunity here for you to use it for anything.
A lot of questions about dark circles. Yes, this can be used to reduce them and help them. This will not disappear them.
Right, and it tightens it, and we combine with fillers, we do other skincare, peels, etc. And this is it, you guys. We're basically done. I'm just blending the edge right now. Show you guys in a second. Okay. So if you take a look at both sides, you can see we pretty much got everything exactly to our markings, all the way up to the lash line. Perfect. Now we're just gonna put we're gonna put PRP and A-cell on her for all the lasers and everything we just did. And she's gonna heal. You guys will see her tomorrow. Anything else?
That's it.
All right, you guys, so that's plasma pen in a full female facial contouring procedure of threads and other things. So stay tuned to see her when she's healed. Can you hit the light for me? Let's put the PRP A-cell on. You guys can